Hey everyone, this is a session on scapular anastomosis. The scapular anastomosis is formed between the branches of subclavian artery and the axillary artery. The branches of these arteries form anastomosis over various regions of scapula. One is the acromion process in the supraspinous fossa, the infraspinous fossa, and anteriorly over the subscapular fossa. From the first part of the subclavian artery arises the thyrocervical trunk. It gives off the inferior thyroid artery, the suprascapular artery, and the transverse cervical, which divides into a superficial branch and a deep branch of the transverse cervical artery. Many textbooks describe it as the dorsal scapular artery. Now, this deep branch of transverse cervical artery descends along the medial border of scapula to form various branches over the scapula. The suprascapular artery also descends over the scapula and forms various branches going towards the supraspinous, infraspinous fossa as well as the acromion. Now, from the second part of the axillary artery, the thoracoacromion trunk rises, which gives off four branches, one of which is the acromion branch of the thoracoacromion artery. From the third part of the axillary artery arises the subscapular artery. It goes on to give various branches. A larger branch also supplies to the scapula. This is known as the circumflex scapular artery. Another branch from the third part, called the posterior circumflex humeral, which winds around the surgical neck of humerus, gives a branch to the acromion. This is hence a branch of the posterior circumflex humeral artery. Normally, the flow of blood is towards the scapula, be it from the subclavian arterial branches or be it the branches of the axillary artery. But in case there is an obstruction in the artery distal to the first part of subclavian artery and proximal to the second part of the third part of the axillary artery, the scapular anastomosis come into effect. Now, this obstruction may be extrinsic or due to a thrombosis. In case of such an obstruction, the scapular anastomosis become patent and the flow of blood would be reversed along the branches of the third part of axillary artery. And now the blood would flow from the subclavian artery and reach the axillary artery, hence bypassing the obstruction in the subclavian, the distal subclavian or the proximal axillary artery regions. You can always trace the reversal of flow back to the axillary artery. Hence, this scapular anastomosis is important to allow proper perfusion of the upper limb. In case the scapular anastomosis is present and there is increased blood flow through these arterial branches, the patient would present with a pulsating scapula. That is all about scapular anastomosis. Thank you.